Communication is key for a geriatrician.
Is that on?
But it's not always easy.
Is that working?
Okay.
Oh, hang on. There we go. Does that work better?
Yeah, I can hear.
You can hear me?
This device connects to Douglas Hill's hearing aid.
I'm a geriatrician, so I'm a specialist doctor who looks after older people.
Mr Hill is among a growing number of older people coming to Australia's busiest trauma hospital after a fall from standing height.
Well, when you get on the floor and you can't get up and you lay there for a couple of hours and your phone's not, you don't know where your phone is, you can't reach it, you can't get to it. It's a pain in the arse.
His recent bouts of blacking out and collapsing have been caused by heart problems. And tomorrow he'll have a pacemaker fitted.
And hopefully that means you won't fall over anymore.
Yeah.
He's taking the news well.
I'll tell you one thing.
Yes.
I had a mate, he said to me once,
Yes.
twice a baby and once a man.
That's right. Yeah.
And not bloody wrong.
Dr Margot Lodge leads a new team called the Geriatric Trauma Service. It was introduced 12 months ago.
There is this recognition that we can work alongside other medical specialists and surgical specialists to provide care for this group of patients who have very specific and complex care needs.
People over 65 now account for 1 in 3 major trauma admissions to the Alfred Hospital.
I might be good at actually treating the injuries and the complications related to the injuries, but all the other comorbidities, how this overlays on the injuries, you need the expertise of the geriatrician.
An increase in admissions for falls from standing height prompted the introduction of the new team.
So the numbers started increasing and we started noticing that their outcomes are bad. They have a plethora of complications, which includes the medical comorbidities plus the secondary injury that has been caused by the fall, and then associated with that, there's a vicious loop of complications that come in after that.
Falls are the #1 cause of hospitalisation and deaths from injury in Australia by a long way. They account for more than 40% of both. People aged over 65 are the most likely to end up here after a fall, and the risk continues to increase with age.
How are you?
Now that I met you, one of the doctors here, I'm feeling tougher too.
Oh, you are.
Duncan Bartholomew couldn't say that a few days ago.
You were pretty crook last week.
He's been here for a month after falling from a ladder while gardening. He had other complications and then came down with delirium, which is common among older people who have long hospital stays.
Delirium, so when a person becomes acutely confused, is a really scary thing to manage, particularly as a junior doctor. Patients can become very agitated. Likewise, they can become extremely sedated and almost look like they're in a coma. And so there's a huge range of different management plans that need to be instituted to look after this very unwell patient with the complication that has a very high mortality and morbidity rate.
He knows it's a dream,
Yes?
but he can't get out of it.
Yeah.
It was the first time I'd experienced something like that, and I'm a nurse, but I had never seen that kind of delirium before.
Preventing or quickly treating complications is a focus for the team.
We take the pressure off the trauma junior doctors because we manage all of that and we educate them as we're going.
Other hospitals are watching what's happening here.
It's just a question of getting the money and the training, but we actually need more resources and more people that are trained in looking after older and more complex patients.
Geriatricians are working in more areas, including emergency, oncology and orthopaedics.
Wherever we have older people with multiple comorbidities, we need geriatricians working alongside the single organ specialists. Much like we have paediatricians where there are children in hospitals.
No, that's
Finally back home, Duncan Bartholomew credits the support of his family for getting him through.
I'm feeling better and getting more confident as the days go by. Home is where I belong.
And it's where his wife says he's going to stay.
It was a tough fight, but I won.
Natalie Whiting, ABC News, Melbourne.